Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be focusing on something that's very common, urinary tract infections, or as we call them, UTIs. They're extremely common, particularly in women, but can occur in men and children as well. If you have ever experienced burning during urination, frequent urgency to go, or lower abdominal discomfort, these are some of the symptoms of a UTI. Joining me is my colleague, Dr. Bryn Henderson, to talk about the causes, the treatments, and prevention strategies. Dr. Henderson, let's start with the basics. What exactly is a urinary tract infection?
A urinary tract infection is exactly what it states. It's an infection that can affect any part of the urinary system. So the urethra, the bladder, ureters, or kidneys. Most commonly, it involves the bladder, known as cystitis.
What are some of the top causes of UTIs?
The majority are caused by bacteria, most often E. coli, which normally lives in the gut, but it can travel into the urinary tract. Other causes include sexual activity, poor hygiene, urinary retention, or anatomical changes.
So, genetic factors, do they influence someone's risk of having multiple urinary tract infections a year?
Yes, absolutely. Some people inherit variations in the genes that control your immune response, or others, the structure of the urinary tract lining. These changes make it easier for bacteria to attach and harder for our bodies to fight the infections.
What about growth and formation? Are there factors from early development that could influence UTIs later on in life?
Absolutely. The urinary tract often develops from urogenital tissue before birth. Any differences in its formation, such as narrowing of the urethra or abnormal positioning, can increase the risk of infections later in life.
Let's talk about traditional Chinese medicine. How do they look at urinary tract infection?
Yeah, isn't that fascinating? Yeah, traditional Chinese medicine perceive UTIs often linked to the patterns of the damp and heat in the bladder. This can result from dietary factors, environmental exposure, or imbalances in the body's organ systems, particularly the kidney and spleen. The heat causes burning and pain, while the dampness contributes to urinary urgency and cloudy urine.
So, what are the most common symptoms for UTI?
Burning and pain during urination, frequent urges to urinate quickly, and cloudy or foul-smelling urine are the most common. There's also associated lower abdominal pressure. If the infection reaches the kidneys, symptoms can include fever, flank pain, and nausea.
All right. So somebody comes in, they feel like they have to go all the time. They've got pain and they say, oh boy, I think I've got a UTI. How do you diagnose it?
We ask for a urine sample right off the bat. It's tested for bacteria. They do what they call a dipstick, and it determines if there's white blood cells and nitrates in the urine. It tells us the color, and it sometimes tells us hydration. A urine culture is often performed anytime there's bacteria in the specimen.
So let's talk about standard of care.
Antibiotics are the mainstay, with the choice depending upon the severity and the organism found. Increased hydration, symptom relief like urinary analgesics can help while antibiotics take effect.
Can people prevent UTIs?
Yes, absolutely. Preventive strategies are individualized, but they include adequate hydration, urinating after sexual activity, wiping front to back, avoiding irritating hygiene products, and for recurrent cases, those that have to take low-dose antibiotics or non-antibiotic preventive measures?
I'll tell you what I have always told my patients. Usually they get UTIs in the middle of the night and would call me at 3 o'clock in the morning, and there would be no pharmacy open. And what's a doctor to do? So I always tell people who have chronic urinary tract infections, more than one or two a year, to always keep parsley in their refrigerator. Just the typical parsley that Denny's restaurant puts on their little garnish. Take a handful of that, throw it in about 4 inches of water, bring it to a boil, let it cool, and then strain it, obviously, and drink that juice. Now, I'll tell you, it's god-awful tasting and it's god-awful smelling. So you hold your nose and you drink it down. But that pain from the urgency and frequency will disappear in 5 minutes. You can use your clock, and I promise you in 5 minutes you'll have relief. Then by the time my office opens at 8 o'clock in the morning, you can get in, or I could call in a prescription and you'll be in relief. I'm not crazy about the cranberries. I know they all say it helps to prevent, but I've never had good success with recommending cranberry juice. I know it's a big thing. So let's talk regenerative medicine, your area of expertise. What could be done?
Well, there's some integrative approaches like probiotics, herbal antimicrobials, and immune support. They're being studied, but they should complement, not replace, evidence-based medical treatment.
Let's talk about your mnemonic that you have.
Well, it's sort of fun. It's FLUSH.
F stands for?
Fluid, stay hydrated.
L.
Loose-fitting underwear and clothing, preferably cotton.
U.
Is urinate after intimacy.
S.
Sanitize with gentle hygiene and avoid irritants.
H.
A healthy gut and vaginal microbiome.
Well, thank you, Dr. Henderson, for your insights. UTIs can be unpleasant, but with early treatment and good prevention strategies, most can be quickly resolved. Remember, it's in adults and children. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.